Osteomyelitis. Osteomyelitis is an infection of the bone. Although Staphylococcus aureus is the most common cause, any organism can infect the bone. Children get osteomyelitis through hematogenous spread, but adults get it from a contiguous, nearby, infection, most often as a result of vascular insufficiency and diabetes. Salmonella is the most commonly identified organism in patients with sickle cell disease. Injection drug use is a significant risk factor for vertebral osteomyelitis in adults. Presentation: pain, erythema, swelling, and tenderness over the infected bone. With vascular insufficiency, there is often an obvious overlying or nearby ulceration or wound. Occasionally, a draining sinus tract is present. Most patients are afebrile. Diagnosis: the best initial test is an X-ray. The most accurate test is a biopsy. If the X-ray is normal, the most appropriate next step in management is an MRI. CT scan is not very useful. Erythrocyte sedimentation rate, ESR, nonspecific. It is useful to follow during treatment. A normal value strongly points away from osteomyelitis. Tip: when culturing the drainage is useful. Never, you cannot reliably distinguish superficial colonization from whatever organism is inside the bone causing the bone infection. You cannot reliably distinguish superficial colonization from whatever organism is inside the bone causing the bone infection. Treatment: osteomyelitis takes weeks to progress. Obtain a biopsy, and then treat the organism that is found. Without a biopsy, it is impossible to know what organism is present and what it is sensitive to. Sensitive staphylococci are best treated with oxacillin, cefazolin, nafcillin, or ceftriaxone. Resistant staphylococci are treated with vancomycin or linezolid. Gram-negative bacilli such as E. coli are treated with fluoroquinolones such as ciprofloxacin. It is essential to confirm the sensitivity of the organism prior to treating with ciprofloxacin. Ciprofloxacin is the only oral therapy for osteomyelitis, but should be used only if the organism is confirmed as a sensitive gram-negative bacillus. Toxicity of quinolones, fluoroquinolones, can cause Achilles tendon rupture from interfering with the growth of chondrocytes. They are also contraindicated in pregnancy and in children because they interfere with bone growth.